We have had a fecal transplant practice for over 8 years now, and we did halt our practice as the pandemic started, trying to figure out how do we manage these patients. And in this study, we're excited to present the results of our screening protocol for donors and also the lack of transmission of SARS-CoV-2 when we perform fecal transplantation in these patients. Hi, everyone. I'm Sahil Khanna. I'm a professor of medicine in the Division of Gastroenterology and Hepatology at Mayo Clinic in Rochester. I'm excited to present the results of our study today. Fecal transplantation for patients with recurrent C. difficile infection during the COVID-19 pandemic. As we all know, that unfortunately this pandemic has disrupted a lot of healthcare. In addition to overburdening our intensive care units and hospitals, it has disrupted traditional healthcare, and also in our world of C. difficile infection, it has disrupted the provision of fecal transplantation or microbiota restoration therapies to these patients. It's been known for the last decade or so that microbiota restoration therapies or fecal microbiota transplantation provides high rate of success for patients with recurrent C. difficile infection. Patients who have C. difficile infection tend to have a risk of recurrence despite not being exposed to risk factors for C. difficile. After one infection, the rate of recurrence is between 20 and 30%, and after 3 or more infections, this rate of recurrence goes up to 60% or even higher. Studies after studies, including randomized clinical trials, have shown a high rate of success, upwards of 90% in some studies, where people do not get the C. difficile infection back. Now, microbiota restoration therapies or fecal microbiota transplantation, which is one example of such therapies, provides high risk rate of success for these patients. But we know that these therapies are dependent on procuring stool from donors. Donors are healthy young individuals with minimal or no medical problems on minimal or no medications, and they're screened out for multiple diseases, including diseases associated with an altered microbiome, such as diarrheal illnesses, metabolic illnesses, neuropsychiatric illnesses, autoimmune diseases, malignancies, and others. These donors are also screened for multiple infections, including HIV, chronic hepatitis, and more than 25 different stool infections. We were doing these donor screening for these patients and then got hit by a pandemic. We have known that SARS-CoV-2 virus, or the COVID-19 causing virus, is ubiquitous in the human body. It affects almost every organ system, and it's also been shown to be excreted in stool. Now that made fecal transplantation very difficult, as there still does not exist a validated stool test for SARS-CoV-2. Additionally, the access to fecal transplantation has become scarce because OpenBiome, the largest stool bank in the nation, had ceased its operations because of the COVID-19 pandemic. We revamped our donor program, where we started testing our donors for the presence of SARS-CoV-2. Donors are screened with a nasopharyngeal swab and an antibody test every 2 weeks. Additionally, they're screened for presence of exposure and symptoms every 2 weeks and every time they donate. Donor stool is quarantined and not released until the follow-up testing is negative. We have this program here at Mayo Clinic, and our partners at the University of Minnesota have had a similar donor screening program since COVID-19 pandemic started. Our donors have been screened every 2 weeks for several months now, with none of the donors being positive. During our donor program, we initially had 2 donors, and one donor decided not to continue because of the frequency of testing. We were able to recruit a second donor after that, and these 2 donors have now continued to get the testing every 2 weeks. Our donors are volunteers, and we call them heroes because they are able to get this invasive test and help our patients out. We have been able to use this donor stool, and in this study, we report our experience of 57 patients who received fecal microbiota transplantation with stool that's been screened during the pandemic. We have had more than a 90% success rate for resolution of C. difficile infection. Additionally, we're excited to report that none of the donors were screened positive for this infection during our program, and none of the recipients contracted SARS-CoV-2 or COVID-19. No adverse events related to COVID-19 were seen. With this kind of protocol, screening donors every 2 weeks and keeping stool under quarantine until follow-up testing is negative, we are able to safely and effectively provide this medical therapy during this pandemic.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.